welcome back to the Africa Dialogues. Amref Health Africa and Dalberg Advisors launched the first edition of the Africa Dialogues, and we navigated the pandemic together. We talked about its impacts on agriculture, women and girls, economy, the response, the local insight, the global insights. And the question is, how does this look? How do we rebuild the continent? How do we rebuild and strengthen health systems?
To make substantial changes in how we operate, in where we invest, in the policy ecosystem, in how even we as Africans engage with each other.
Before we can talk about building back better, in some instances we have nothing built at all. So we are actually starting from scratch.
How do we assure Africa's socio-economic recovery, and what will be the role of vaccines?
COVID has really uncovered a lot of things, deficits in our economies and in our health systems.
We must upgrade infrastructure. We must introduce progressive taxation, particularly at the national level. We must match our education curriculum with markets of tomorrow. There's too much of a mismatch. Furthermore, UNDP projects that 4% increase in people living in extreme poverty is going to be seen across the African continent.
Africa now has received maybe 276 million doses of vaccines for its 1.3 billion people. About 200 million have been administered. We are way below any sizable target of covering the population, whereas high-income countries have booked more than 340% times of their population.
We need equity. We need equity, we need justice. What we have right now is a total global imbalance of power. And so we can talk as much as we want about wanting to build back better, but until we redress the power imbalance between the global north and the global south.
We realize that in Africa, there is a major problem with regard to gender equality because we do not include women in whatever it is that we do.
Thank you for your incredible contributions. Thank you to all the people who've joined us from all parts of the world, as we've seen in the chat.